Kia ora everyone, this is almost everything you'll need to know about the anatomy of the neck part 2. In part 1 we looked at the structures that make up the neck in a schematic way using an axial section. Today we'll look at those same structures but in layers. Our first image here is of the most superficial layer after the skin and subcutaneous tissue and the superficial veins have been removed, and also the distracting viscerocranium has been removed in our model. And we can see the platysma muscle draped over the anterior neck here and attached up in the mandible, and poking through the platysma muscle are the superficial or cutaneous nerves that have arisen from the cervical plexus. And we'll have a closer look at those nerves with platysma removed. So there are 4 of these nerves, and their names are lesser occipital. There is a greater occipital from the dorsal ramus of the C2 nerve. Lesser occipital, greater auricular, transverse cervical, and supraclavicular, the largest branch here. And these nerves have all emanated from this position here about a third of the way down the sternocleidomastoid muscle, and because they've all branched out from here, that point is known as the nerve point in the neck, which is roughly the point where Mr. Spock or some other Vulcan grabs you to perform the Vulcan nerve pinch, which immediately results in your incapacitation. Now these names, lesser occipital, greater auricular, transverse cervical, supraclavicular, can be remembered because they rhyme and make up a nice ditty. One of my students even suggested that it sounded like a haiku, except I looked up the rules for a haiku and it doesn't meet any of them, so yeah, nah. We can also see here sternocleidomastoid, it's 2 heads, one clavicular, one sternal, and the trapezius muscle, and these form the boundaries, along with the clavicle, of the posterior triangle of the neck, which your book refers to as the lateral cervical region. From the mastoid process, the other triangle, the anterior triangle, is bounded by the mandible here and the midline and the other border of sternocleidomastoid. And both those triangles can be further subdivided, which we'll deal with later. Another anatomical factoid is that the internal jugular vein can be reliably found between the 2 heads of the sternocleidomastoid, just deep to these structures. So if you're looking to poke a needle in it, that's a place where it can be accessed. We'll remove the cutaneous nerves, and we can see in the lateral cervical region or posterior triangle that the most prominent neurological structures left behind here the supraclavicular parts of the brachial plexus. Here's the infraclavicular parts, and therefore we know that this muscle here is the anterior scalene, this muscle here is the middle scalene, and the scrawny guy here is the posterior scalene. This is levator scapulae. And if we go ahead now and remove sternocleidomastoid, we can see other neurological structures and also the infrahyoid or strap muscles of the neck. So note that the carotid sheath would normally lie immediately deep to the sternocleidomastoid, but it's been removed from this diagram just for clarity and concentrate on the nerves and muscles because they go together better. We can see even more messy neurological structures. I forgot to mention in the earlier video that the sympathetic chain extends up into the neck from its origins in the thorax. So I'll get rid of that. And if you look carefully, you can see that one of these neurological structures is arranged in a loop like this. And these are the motor branches of the cervical plexus, and they're always arranged in this loop, which is known as the ansa cervicalis. Ansa is Latin or Greek for loop, and the motor branches supply the infrahyoid muscles, which we'll have a look at shortly. I'll just remove the scribblings and highlight the nerves with the app. So the infrahyoid muscles that the ansa cervicalis supplies are the muscles that are attached to the hyoid bone here from below. And the one with the most anterior attachment on the hyoid bone here is sternohyoid. The next in line is this very characteristic 2-bellied muscle, which is omohyoid. omo means shoulder, and the inferior belly of omohyoid attaches to the scapula, and there's a fibrous sling that arises from the clavicle that the intermediate tendon of the muscle runs between. The other two muscles of the infrahyoid group are almost a compound muscle that together form another sternohyoid. We'll remove the two we've identified so far, and we can see that the remaining two comprise a sternothyroid. So this muscle attaches to the thyroid cartilage, which isn't shown here, but the remaining muscle is thyrohyoid, so from the thyroid cartilage to the hyoid bone. So sternothyroid and thyrohyoid. I'll just declutter this image by removing sternothyroid and thyrohyoid, and also these nerves that are actually from the left-hand side. And I've also removed the brachial plexus, and we can concentrate now on the remaining nerves. This bigger, longer one would be running in the carotid sheath, if the carotid sheath were shown, and this is a recurrent branch of it arising back out from the thorax, and this is the vagus nerve and its recurrent laryngeal branch, so the recurrent laryngeal supplying the larynx. In fact, the recurrent laryngeal changes its name as it approaches the larynx to inferior laryngeal nerve, and this nerve here is the superior laryngeal nerve, which is also actually a branch of the vagus nerve, just arising much more proximally. So together the superior and inferior laryngeal nerve supply the larynx, and they are all parts of the vagus nerve, so the vagus nerve supplies the larynx. And finally, this smaller nerve, which also descends into the thorax, is the phrenic nerve from C345, keeping the body alive, supplying the diaphragm. Putting some of the structures back and just having a look from a slightly more superior viewpoint, we can see here the posterior triangle or lateral cervical region, further divided by the inferior belly of omohyoid, and the upper part remaining is the occipital triangle because its apex is up at the occipital region, and up there is the occipital artery. The lower region is known as the omoclavicular triangle, not very triangle shaped in this diagram, and it's also known as the subclavian triangle because the subclavian artery would be found here and is palpable if you stick your finger in far enough, crossing the first rib between the anterior and middle scalenes, where it's joined by the brachial plexus, which moves to surround the artery with its cords. The subclavian vein crosses the first rib in front of the anterior scalene muscle, so the muscle separates the two vessels. And finally, looking from more inferiorly now, we can appreciate the structures that subdivide the anterior triangle. So that was from the midline along the mandible towards the mastoid here in this part of sternocleidomastoid. It's subdivided by the superior belly of omohyoid and by the hyoid bone itself, and by this other two-bellied muscle which is called digastric, which arises posteriorly from the mastoid process alongside sternocleidomastoid, and it has an intermediate tendon that runs through this loop of fascia which is attached to the hyoid bone, another trochlea, and its anterior belly attaches near the midline of the body of the mandible. And from there we get an omotracheal or muscular triangle. The trachea is within it inferiorly, and also it's known as the muscular triangle because of the strap muscles or infrahyoid muscles of the neck. We have a carotid triangle behind omohyoid. We have a submental and a submandibular triangle between the mandible and the hyoid, separated by the anterior belly of digastric. The structures that we're interested in are mostly within the carotid triangle. There's this very nice table in your books outlining which things belong in which triangle, and these are the ones here to concentrate on. There's also this quite lovely diagram which summarizes most of the nerves in this cervical region. Moving on now to the vascular structures. We can see by this diagram that the main vascular structures are the internal jugular vein and the common carotid artery initially running in the carotid sheath, which would be surrounding them, and until the common carotid divides into the internal and external branches here at about the level of the hyoid bone, which is about the C4 vertebra. Looking in more detail at the arteries, we can see that the internal carotid is an unbranched tube that just ascends to the base of the skull, entering the carotid canal via a foramen in the petrous part of the temporal bone. And the external carotid has 8 branches, only 7 shown here. They've missed off the first smallest branch, which is the ascending pharyngeal, which would be about here. The next is the superior thyroid, then comes the lingual and the facial arteries, the facial going behind the mandible here and then crossing over just behind where the masseter would attach to the body of the mandible, carrying on here. Then there's the occipital artery, the posterior auricular, and then the 2 terminal branches, the superficial, temporal, and maxillary branches. The deep temporal is a branch of the maxillary up here. I'll just zoom in to see all the branches a little more clearly. So ascending pharyngeal, not here, superior thyroid, lingual, the facial, a bit more clear there, occipital, posterior auricular, superficial temporal, and the maxillary hidden behind the mandible, but we can remove that, show it more clearly, maxillary artery, superficial temporal artery. Memorizing the names of these branches is sometimes a requirement of anatomy exams. It's a bit tiresome. Being 8, you basically need a mnemonic. There are several. I think that the best one, as she lay flat, Oscar's penis squirted madly. It's a heteroerotic tale as old as time about an excitable young man called Oscar who is finally about to consummate, with willing consent, his affection for a much desired she, and just as the path to glory is laid out before him, finds that his occipital and frontal lobe impulses overcome his poor hypothalamus, who switches control from the parasympathetic nervous system to his sympathetic nervous system a little too early, and the cork comes out of the champagne bottle quite before the stemware is out of the cupboard. So the whole thing's a bit of an anticlimax, really. Here's a photo I found of the internet of the grisly aftermath. It's not too bad, but as you can see, there are no winners here. I don't like using mnemonics to remember things, but in this case, at least it's a short, self-contained, memorable story. And the only detail that you really need to recall is that the person with the penis's name is Oscar, because O for occipital artery. In fact, any male name that starts with O would do, but the choices are fairly limited. Most Olivers are either too young and hungry or too old and silly. Oswalds are too crooked, evil, and murderous. And Ozymandiases tend to be too preoccupied with their schemes to save humanity by killing millions when they're not being distracted by Rorschach and Night Owl 2. Anyway, that's almost all you need to know about the anatomy of the neck, part 2. I'm not sure what's coming next, but whatever it is, I hope it doesn't take as long as this one. Until then, ka kite. Ooh, bonus anatomy. Fibularis brevis.